Good afternoon. This is Dr. DEEPALI Patil from JPES Homeopathic Medical College, Kolhapur. I am the head of the Department of Surgery. I welcome you all for today's session, and my today's topic is blood transfusion. So before going to blood transfusion, we will first see what is the definition, function, and composition of blood. So we will have a quick review on introduction of blood. So I will define first what is blood. Blood is a life maintaining fluid that circulates through the body's heart, arteries, veins, and capillaries. It carries away waste matter and carbon dioxide and brings nourishment, electrolytes, hormones, vitamins, antibodies, heat, and oxygen to the tissues. Functions of blood are many and complex, and many disorders require critical care. I'll repeat, I will repeat the definition of blood. It is a life maintaining fluid that circulates through the body's heart, arteries, veins, and capillaries. It carries away the waste matter and carbon dioxide and brings nourishment, electrolytes, hormones, etc. towards the tissues. Next, we will see what is the composition of blood. The blood is constituted by two factors. One is liquid part and another is the cellular component of the blood. The liquid part of blood is called as plasma, and it is made up of two components, that is fluid, which is also called as water. It constitutes 91% of the total blood volume, and the solid part constitutes 9% of the total blood volume. This solid part is again divisible into two different parts, that is inorganic components and organic components. These inorganic components include sodium, potassium, calcium, magnesium, chlorides, etc. And organic components includes proteins, hormones, vitamins, lipids, and other organic metabolites like glucose, amino acids, urea, uric acid, etc. And the cellular component includes the blood cells, that is RBCs, WBCs, and platelets, and it constitutes 40 to 45% of the total blood volume. So this is the composition of blood. Next, so we will see what is the definition of blood transfusion. Blood transfusion is the intravenous administration of whole blood or its components such as plasma, packed red blood cells, or platelets to a patient. Blood transfusion is the intravenous administration of whole blood or its components such as plasma, packed red blood cells, or platelets to a patient. Most of the times, the term blood transfusion is misunderstood by the students. Blood transfusion doesn't always mean transfusion of whole blood. Rather, it means transfusion of whole blood or its components like RBCs, platelets, fresh frozen plasma, cryoprecipitate, depending upon the requirement of the patient's disease. Next, so before undergoing the blood transfusion, process of blood transfusion, grouping and cross-matching of the recipients and donors should be done to prevent complications due to incompatibility. So we should have the knowledge of basic blood groups. So we will see what are the different types of blood groups. Each person has one of the following blood types or groups, that is A, B, AB, or O. Also, every person has blood either Rh positive or Rh negative. Rh means it is a rhesus factor, and it is nothing but inherited antigenic substance which is present over the red cell membrane. So, the person's blood group, if the person is said to be Rh positive, it means that he has antigenic substance over the surface of his RBCs. So 85% of the common people have these antigens on the RBCs, and they are termed as Rh positive, and only 15% of the people don't have this antigen, and so they are termed as Rh negative. And depending upon presence and absence of this antigen, the blood group may be defined as positive or negative. So we will see in this picture, see first picture where the person is having blood group A. And please note the direction of arrow. That means there is arrow O and A. That means the patient having blood group A can receive the blood from group A and O. And the person who is having blood group B can receive the blood from group B and O. Next picture shows that the person who is having blood group AB can receive blood from all the from anybody, that is from blood group A, B, AB and O, and the person from O blood group should receive only blood from group O. Next. Next, sir. Here is another diagram giving idea about the cross matching. The first column is about donor's blood group and second column is about recipient's blood group. First, we will see patient having blood group O can donate blood to patients having blood group O, A, B, and AB. Patient having blood group A can donate his blood to patients having blood group A, B, and AB. The patient or the person having blood group B can donate his blood to persons having blood group B and AB, and the person having blood group AB can donate only to the person having blood group AB. The blood used in the transfusion must be compatible with the patient's blood type. Type O blood group is called as universal donor, and people with type AB blood are called as universal recipients. People with Rh positive blood can get Rh positive or Rh negative blood, but people with Rh negative blood should get only Rh negative blood. Next, then we will see what are the different types of blood transfusion. Sorry. There are three types of blood transfusion. First is allogenic blood transfusion, second is autogenic, and third is exchange blood transfusion. First one is allogenic. As the word itself suggests, allo means different. In this type of blood transfusion, the patient receives the blood from someone else. This is called as allogenic blood transfusion. Second is autogenic blood transfusion. This type of blood replacement is followed in planned elective surgeries. And here, the person must be donate his blood 4 to 5 weeks prior to the surgery. And third is the exchange blood transfusion. This is a medical procedure in which the blood is removed and replaced with the plasma or donor of blood. This is done via a catheter. This procedure, that is exchange blood transfusion, is done to save the life of adult or child which is having life-threatening blood abnormalities such as sickle cell anemia. The exchange transfusion reverses or counteracts the symptoms of dangerous diseases like jaundice and other blood diseases like sickle cell anemia. So next we will see what are the purposes of blood transfusion. First, to increase circulating blood volume. Second, to increase the number of red blood cells and maintain hemoglobin level. Third, to provide plasma clotting factors to help in controlling bleeding. And last, to combat infection due to decreased or defective cells or antibodies. So we will see in detail. First purpose, to increase the circulating blood volume. The normal volume of circulating blood is 4.5 to 5 liters in a human body. So whenever there is a condition, when there is blood loss or huge extensive plasma loss in certain cases like acute extensive burns, acute extensive hemorrhages, then the patient should have replaced the blood volume. In such conditions, blood transfusion is needed. Second is to increase the number of red blood cells. In certain patients, there is defective formation of RBCs, or there is premature destruction of RBCs, or premature destruction of RBCs, which leads to anemic conditions. Such conditions may require blood transfusion. Then also certain diseases in which there is deficiency of clotting factors requires blood transfusion. And in chronic illnesses, when the immunity is decreased, to hasten the recovery, blood transfusion may provide antibodies to the patient. Next. Next, sir. Then we will see indications of blood transfusion. First one, after surgery, major extensive surgeries like organ transplant, etc., require blood transfusion. Then trauma or hemorrhage. It may be either internal or external hemorrhage. Second is severe anemia. Different types of anemia, such as iron deficiency anemia, megaloblastic anemia, sickle cell anemia, thalassemia, aplastic anemia, they may require blood transfusion. Third indication is leukopenia. As we all know, leukocytes means white blood cells, and leukopenia means decrease in number of WBCs. And last is agranulocytosis. So this is a clinical condition where the bone marrow does not produce enough or mature WBCs. We can see in this picture the peripheral smear of a normal person and that of an anemic person. So the red blood cells, they are given in oval shape, red color. The white cells are indicated in small white color, and the small tiny blue colors are the platelets. We can see the difference between a normal and anemic patient. Then we will see components of blood transfusion. Blood transfusion doesn't always mean transfusion of whole blood. Some patients may require certain components of blood, such as RBCs, platelets, or cryoprecipitate or clotting factors. So we will see what are the different components of blood used for blood transfusion. Each unit of blood is tested for evidence of hepatitis B, hepatitis C, human immunodeficiency virus 1 and 2, and syphilis. The blood is then processed into subcomponents. First is the whole blood, then packed cell volume, fresh frozen plasma, platelets, and cryoprecipitate. I will repeat once again. Different components of blood transfusion. First may be whole blood. Second, packed cell volume. Third is fresh frozen plasma, platelets, and cryoprecipitate. The whole blood is nothing but unseparated blood which contains its all components and also contains an additional anticoagulant as a preservative solution. 1 unit of whole blood contains 450 ml of donor blood and 50 ml of anticoagulant as a preservative solution. The hemoglobin of such whole blood is approximately 12 gram per milliliter, and hematocrit is 35 to 45%. Hematocrit means the percentage of RBCs, and normally it is 45 to 55%. Remember one thing, this whole blood does not contain any functional platelets. This whole blood is stored between +2 and +6 degrees centigrade in a blood bank refrigerator. Transfusion should be started within 30 minutes of removal from refrigerator and completed within 4 hours of commencement because changes in condition may occur due to red cell metabolism. That is fresh frozen plasma. The fresh frozen plasma is rich in coagulation factors. It is separated from whole blood and stored at 40 to 50 degrees centigrade with a 2-year shelf life. It is the first line of therapy in the treatment of coagulopathic hemorrhage. I will repeat, fresh frozen plasma is rich in coagulation factors. It is separated from whole blood and stored at 40 to 50 degrees centigrade with a 2-year shelf life. It is the first line of therapy in the treatment of coagulopathic hemorrhage. Next component and most important component of blood is cryoprecipitate. Cryoprecipitate is a supernatant precipitate of fresh frozen plasma and is rich in factor VIII and fibrinogen. It is stored at minus 30 degrees centigrade with a 2-year shelf life. It is indicated in low fibrinogen states, that is less than 1 gram per liter, or in cases of factor VIII deficiency and the disease called as hemophilia A or von Willebrand's disease, and as a source of fibrinogen in disseminated intravascular coagulation. This cryoprecipitate is indicated in low fibrinogen states or in cases of factor VIII deficiency, that is hemophilia A, von Willebrand's disease, and as a source of fibrinogen in disseminated intravascular coagulation. Pooled units containing 3 to 6 gram fibrinogen in 200 to 500 ml raises the fibrinogen level by approximately 1 gram per liter. It must be infused within 6 hours. Next, next component is packed red cells. Packed red cells are the cells that are spun down and concentrated. 1 unit of packed red cell is approximately 330 ml and has a hematocrit of 50 to 70%. They are stored in a SAGM, that is saline adenine glucose mannitol solution, to increase their shelf life to 5 weeks at 2 to 6 degrees centigrade. These packed RBCs are given to increase the oxygen carrying capacity of blood, and it also helps to get rid of carbon dioxide and other waste products. 1 unit of RBC raises the hematocrit by 2 to 3%. Pre-transfusion assessment. The patient's history of previous transfusion, reactions to transfusions, number of pregnancies a woman has, health problems, cardiac, pulmonary, and vascular diseases should be ruled out before blood transfusion. Physical assessment of the person should be done. It, uh, it, uh, there must be baseline vital signs should be observed like pulse, blood pressure, temperature, and respiratory rate. In auscultation of lungs, if for any foreign breath sound, crepitations, etc., which will indicate the functional ability of lungs, and patients use, if the patient is using accessory muscles of respiration, if there is edema and jugular vein distension, then these are the signs of right ventricular failure, which is also called as cor pulmonale due to lung diseases. In such conditions, blood transfusion may prove fatal due to circulatory overload. We must also see for skin rashes, petechial and ecchymosis, icterus, etc., which gives an indication of underlying systemic disease. Then patient's teaching. The patient should be taught about the signs and symptoms of adverse reactions. Next, then we will see how the donor is selected for blood donation. First, should not be suffering from any illness. The donor should not have donated blood within previous 3 months. He should be healthy and in the age group of 18 to 65 years. She should not be pregnant, should have hemoglobin level above 12 gram percent, and should have normal vital signs. Then we will see how the patient is prepared for blood transfusion. Explain the procedure to the patient and relatives. Ask whether he or she has undergone prior transfusion and reactions. take informed consent from patient or relative, and provide comfortable position to the patient. You can see the comfortable position which is given to the patient in the picture given at the side of this slide. Next, now we will see what are the different complications of blood transfusion. This is the most important topic from for today. First, we will see hemolytic transfusion reaction. The word itself, hemolytic, suggests hemolysis, that is, destruction of RBCs. This hemolytic transfusion reactions occurs due to incompatibility of blood, improper storage of blood, storage beyond 21 days, warming of blood above 40 degrees Celsius, or by exposure of red cells to dextrose solutions. I will repeat. Hemolytic transfusion reactions occurs due to incompatibility of blood, improper storage of blood, storage beyond 21 days, warming of blood above 40 degrees Celsius, or by exposure of RBCs to dextrose solutions. It is indicated by fever, chills, headache, dyspnea, cyanosis, chest pain, etc. There may be a drop in blood pressure, oliguria, or may cause anuria. Due to hemolysis, the blood supply to the kidneys is decreased, leading to renal failure and which will lead to oliguria or anuria. Next transfusion reaction is pyrogenic reaction. Pyrogenic word itself indicates fever. Its incidence gets decreased nowadays due to use of disposable sets. It occurs when there are some external substances present in the tubing. It is characterized by fever with chills, nausea, vomiting, diarrhea, headache, backache, delirium, shock, and renal failure. Then certain allergic reactions may happen during blood transfusion. They are due to individual sensitivity to plasma proteins, and these reactions are characterized by itching, laryngeal edema, and bronchial spasms. I will repeat, these allergic reactions are due to individual sensitivity to plasma proteins, and it is characterized by itching, laryngeal edema, and bronchial spasms. Next complication is circulatory overload. It appears in people suffering from anemia as they need only RBCs, but when they receive whole blood. Patients with heart failure are more vulnerable to this circulatory overload. Circulatory overload, this means if the person is having long-standing or chronic anemia, heart uncompensating hypertrophy, which leads to congestive cardiac failure. Next, transfusion reactions are infectious diseases. Various diseases like hepatitis, AIDS, malaria, syphilis, etc. are transmitted through the blood when it is not properly checked. This is hepatitis, malaria, syphilis, etc. are transmitted when it is not properly checked. Next is anaphylactic reaction. These occur rarely, but are life-threatening conditions characterized by a severe respiratory and cardiovascular collapse and severe GI disturbances. Anaphylactic reactions are very rare but are life-threatening, and they are characterized by respiratory and cardiovascular collapse and severe GI disturbances. The treatment for anaphylactic reactions include A, B, C, and D. That means maintenance of airway, circulation, breathing, and drugs like sympathomimetic drugs and corticosteroids. Next, we will come to the last session of this topic, that is homeopathic management. If homeopathic remedies are given depending upon symptom similarity, along with the allopathic medications, they can prove beneficial to the patient. So we will see what different homeopathic remedies are beneficial to the patients of reaction of blood transfusion. First, there is spelling mistake. It is not anaphylactic. It is allergic reaction can be treated with Apis mellifica, Urtica urens, and histamine. And the cardiac complications or circulatory overload failures can be managed with digitalis, spigelia, and crataegus. So, with this homeopathic management, we have come to the last session of today's. हॅलो, शेवटच्या 5 मिनिटात आपण एक व्हिडिओ बघूया सगळेजण. आवाज येत नाहीये सर. हॅलो,
In this film, we're going to tell you what to expect when you have a blood transfusion. A blood transfusion is a common procedure which involves taking blood from one person, the donor, and giving it to a person who requires more blood. The most common reason for a blood transfusion is to address a shortage of red blood cells in the blood. Red blood cells are essential for carrying oxygen around the body. Sometimes this happens because the bone marrow, which produces red blood cells, can't make enough of them. You will need to sign a consent form before your blood transfusion. A nurse or doctor will go through this with you, and you can ask as many questions as you like. A nurse or doctor will take a small blood sample to check your blood type. It's very important that you're given blood that's compatible with your blood type, so you must be correctly identified at each stage of the blood transfusion. You'll be asked to state your full name and date of birth. If you're an inpatient, wearing an identification band with your correct details is essential. If you're an outpatient, you will not usually be given an identification band. Some people will be given a card when they have their blood transfusion to say that they can only get specific types of blood. You need to keep this card safe and show this to your nurse or doctor. You can eat and drink normally before your transfusion. A blood transfusion is a straightforward procedure which is carried out by a nurse. You can be sitting up or lying down during your transfusion, your blood pressure will be tested before your transfusion and at roughly 15-minute intervals throughout the transfusion. The blood is usually given through a tiny tube called an intravenous line, which is inserted directly into a vein in the arm using a fine needle. The insertion may cause slight discomfort for a moment, but you shouldn't feel anything during the transfusion. It may take up to 4 hours to give each bag of blood, although this can be safely speeded up when necessary or if it's urgent. You may be given more than 1 bag of blood as part of your treatment. If you have 2 or 3 bags, the procedure can take much longer as subsequent bags must be delivered. You'll be observed before, during, and after your blood transfusion. If you feel unwell during or after your transfusion, you should inform your nurse or doctor immediately. People usually choose to bring a book, laptop computer or tablet, music, or other distractions to fill the time during the procedure. After a blood transfusion, your temperature, blood pressure, and heart rate will be checked. Then the intravenous line will be taken out of your arm and a small plaster applied. You may have slight bruising or soreness for a few days at the site where the line was inserted, but otherwise you should feel normal. You may need blood tests that show how your body is reacting to the transfusion. If you're an outpatient, you can go home immediately after your blood transfusion. Activities and continue your usual diet and any medications. Blood transfusions are very safe. Any risk to your health will be far outweighed by the benefits of having a blood transfusion if your doctor has referred you for one. Every year, approximately 2.5 million units of blood or blood components are transfused in the United Kingdom, and it's extremely rare for any side effects to be reported. In the unlikely event that you develop a temperature, chill, or rash, this reaction will usually be mild and can be treated with over-the-counter medicines such as paracetamol or antihistamines, or by slowing down or stopping the blood transfusion. Severe reactions to blood transfusions are extremely rare. If they do occur, they usually happen in the first few minutes of the transfusion, and staff are trained to recognise and treat them. The likelihood of getting an infection from a blood transfusion is far lower than most everyday risks. For example, you're more likely to...
And I hope you all have understood today's topic, and all the very best for your exams. And I thank all of you for giving me this opportunity. Thank you.